whitening trays to do the whitening of the teeth, I have my patients basically use a very concentrated fluoride toothpaste. And what that does is basically strengthen the enamel, strengthen the tooth, and really cut down the sensitivity when they go through the treatment process. This is just one product that's by Ami Control RX that we use. These are all prescription that the dentist prescribe. You can't find this on the over-the-counter. The patient will use this usually for a week or two before they start the whitening treatment, and they will use this before they put the trays on, and then after they remove the tray, they will use this again. And that will keep the enamel strong and healthy and also control the sensitivity. The other thing is when you use the gel and you place it onto the tray, the gel should be basically a thin strip on the outside part, on the the facial part of the tray, and not on the tongue side of the tray, so that the gel will ooze on the facial part of the enamel. And usually it should place in the mouth for about an hour, and no more than that. If you leave it on longer, it's going to cause irritation too, because the enamel just cannot handle that length of irritation, the length of time. And so for most part, the patient will see result usually after the first treatment. They see the change in color, but sometimes it will be a little bit chalky or flossy, or the color is not creamy or smooth. It's because the easy part is being bleached out. The more tenacious thing is going to take some more time for it to bleach out. So on average, the treatment you should take it's 2 weeks if you whiten your teeth every day or every other day. Ideally, I like my patient to do it every other day to give the enamel a chance to breathe and to basically heal itself. It takes longer, but what we found is if you don't rush this process and you allow it to take its course slowly, your color that you achieve, that you like, actually will last longer because the enamel is not damaged.